Welcome to Caring for Yourself, the second video in a 5-part series on bereavement and grief in the nursing home setting, facilitated by Dr. Toni Miles. The second series is an additional 5 parts on social isolation and loneliness, facilitated by the Eden Alternative and Dr. Maureen Mikas. These learning sessions have been created for the WellbeingTREE, or Teaching Resilience to Empower Elders Learning and Action Network, brought to you by Altarum with grant funding from the Michigan Health Endowment Fund. Altarum, a nonprofit headquartered in Ann Arbor, has been in existence for over 70 years. We help federal and state health agencies and foundations improve health equity and outcomes through better systems of care. From lower-income children to nursing home eligible older adults, our mission is to help those whose health is negatively impacted by social determinants. We are excited to bring you this collaborative learning platform offering Michigan nursing home leadership, staff, residents, and their families tailored learning to better understand and implement evidence-based strategies to improve social isolation, loneliness, bereavement, and grief that is experienced in nursing home communities. We hope that it is the first of many such educational sessions we're able to provide the residents and staff of Michigan homes. This Learning and Action Network, or LAN, is made up of 10 parts. These first 5 sessions were designed to help attendees to better recognize and understand bereavement and grief in coworkers and residents, better manage their individual experiences with bereavement and grief, as well as to improve their ability to help others cope with the same. So why grief and bereavement and social isolation and loneliness as topics for education? Nationwide in 2019, 17% of nursing home residents died. Bereavement in nursing homes is not a new issue with the pandemic, nor will it go away as the pandemic subsides. In 2020, deaths went up to 22%. A combination of COVID-19 and deaths of despair drove this increase. Isolation leading to loneliness, depression, failure to thrive. This is especially common among those experiencing substantial loss and is linked to an increased risk of anxiety and depression. Older adults and those with cognitive impairment are more likely to experience complicated grief. The coronavirus has taken the lives of at least 162,589 residents and 2,913 nursing home staff as of January 1st, 2023, according to CMS. This is why we wanted to provide support by teaching specific strategies to better manage bereavement. And today's collaborator, Dr. Miles' ongoing work on unaddressed loss, grief, and lack of bereavement care that is needed to process morbidity and mortality associated with COVID made her the logical and passionate partner we needed for this topic. In addition to being a national expert on grief and bereavement in the nursing home setting, Dr. Miles is an epidemiologist, researcher, emerita professor, and current Pope Eminent Scholar at the Rosalind Carter Institute for Caregivers. She has been focusing on population health effects of the deaths of friends and family members for over 9 years. Her best practices in bereavement care and long-term care is the guide that has informed this 5-video series and will be made available with the videos. Welcome, Dr. Miles, and thank you for speaking with us today.
Thank you, Christy, for inviting me and giving me this opportunity to participate in this process. Today we're gonna talk about caring for yourself, because each building is like a small village. Each building is unique. Each session, we're gonna encourage you to discuss what we talk about here among yourselves and among the persons that you care for. And what we heard over and over again in the videotaping we've done of folks who work and live in these environments is that recognizing the signs of grief is the most important starting place. A lot of people are in denial about their bereavement because it's painful. Today, we're going to talk about how do you recognize it for yourself, and how can you teach your residents to recognize it in themselves. When you sit down to do this with your coworkers and residents, encourage them to tell their stories. Stories are how we help each other learn what's happening. Here are the guidelines we'd like you to adhere to or understand that the most experienced among you, whether it's residents who have been there for a long time or caregivers, they have knowledge of dying and death that that could help us all. They have empathy and compassion. They have strength because doing this takes a lot of strength. And they also understand there is a limit at any moment to the amount of strength they can bring. So they have an understanding that they need to refresh themselves. Here are the objectives for today's session. When we're done, you should be able to understand the phrase that any loss you grieve is valid. Too often, those of us who are grieving are ashamed of what we're grieving about, but there's no shame in that. And you'll hear people talk about that idea. We have other people who are going to talk to us about the physical signs of grief. It's not always just emotional sadness. Some people manifest their grief in bodily pain. Important to understand those physical signs of grief. And then we're going to finally talk about strategies that give you a sense of how to look for, take advantage of, and accept the support you need for your grief. And then part of this, underneath all of this, are some fundamental questions. There's language that people who are bereaved have told us. What works for them, what you can say to them, because oftentimes people don't know what to say. Also, what you should avoid. Strategies to show support, and for both the resident and for coworkers. They're both bereaved, but they have slightly different needs, and being attuned to that can help you help them. As you move through these objectives, encourage people to tell stories. There's a lot that we can complain about, but as we did the filming and we talked to people for hours and hours, what we got them to help us understand, and what we're sharing with you, is how they can triumph and how they can do better. And I think these days we all need that kind of stuff. Learning objective number 1, you should be able to articulate and apply simple bereavement care strategies recommended by people in your environment and both residents and staff. And so as you think about this slide, ask the following questions that might spark some conversation. What kinds of emotional responses will you see people manifesting? It's not always sadness. Oftentimes, bereaved people are angry, and you'll hear that explicitly stated in no uncertain terms by some of our residents. And can you think of some examples that you've experienced for each of these? A second one is that, what do you think about these emotions? Do you feel like one is more appropriate than the other, and why do you feel that way? So I'm going to ask Christy, who's working with me to present this, to read the quotes, because these are direct quotes from residents.
A few years ago, I lost some keepsakes that had a lot of sentimental value to me. Some of them had been inherited from family, and others were items that I had collected over my life. I don't think that it is reasonable to grieve over physical objects, but I did. I started crying and couldn't stop.
And that is a direct quote from a resident. And here's another video from another resident talking about that.
My somewhat younger cousin and his wife have ghosted me after years of being very friendly and loving, and I have no idea why. And I have tried to find out, but I've had not one word from them since around Easter time, when they just stopped communicating. And this hurts a lot worse than death, actually, because I feel like I've done something to cause it, and I have no idea what I did. I have no way to apologize. I have no way to know what's going on, and that really hurts.
We included this because it really is important to understand there are different ways that people view loss and the change that comes with it. You're seeing, those of you who are watching this session, this is occurring through some passage of time after you've had the first encounter. So you've hopefully had a chance to reflect on what you learned in the other one and bring it here. But the bottom line for this, the best practice, thinking about the different kinds of loss are: any loss you grieve is valid, and understand that grief can include the loss of pets, treasures, abilities. The ability is an important one because a lot of people have physical declines with their chronic illnesses as it goes on, or ideas. Families and individuals with dementia do go through a phase where they're grieving the loss of their cognitive functional activities. Grief can come from anywhere and needs to be acknowledged and responded to. Now on to objective 2. We talked about sort of the emotional stuff, but grief also manifests itself in bodily sensation. And if you've got someone in your group who can basically talk about that, have them tell you a story. And we have some similar kinds of things here. I'm going to let Christy read the quote first.
As a caregiver, you have to take care of yourself first. In an airplane, they tell you to put on your own mask before you help other people with theirs. Or if you think about a pitcher of water, you cannot continuously pour from it without refilling it.
That's key. And again, this was told to us by someone who works in the environment. Here's another person talking about that.
I'd say some of the strangest things I've noticed is these weird little pains you get. Like, and that was one of the things that I had learned, that grief can show up in your knuckles hurt, or your back hurts, or your neck hurts. I've had probably more migraines in the last 3 years, digestive issues, more susceptible to immune, viruses and things. And so because of that, I try to take care of myself. I try to make good choices and think about, food as actual chemical, not stress eating, or, which could be the tendency, right?
And my husband had only been gone not quite a year when I came here. So, in hindsight, a year, at the end of a year, is just the beginning of you trying to get well again. I'm very sure at this time in my life that it takes at least a minimum of a year to get yourself back together and to get the mush out of your brain. You feel like you can't think, you can't drive, you can't do anything clearly. So that was a hard time for me.
The beginning, recognition is one way to help you start healing. It's not in and of itself, but it really gets you going in the right direction. And again, we have best practices that were shared with us, with other people. Grief hurts, and it's not just emotional, it can be physical too. And one of the ways people who are trying to work through this, they move. It doesn't have to be running marathons, walking, especially with someone, if you want to do that, engaging your mind. The value of the physical, if you are having trouble sleeping because of grief, taking long, slow walks can help ease you into a better sleep pattern. So all of this fits with caring for yourself. And understand, self-care takes time. You have to kind of keep going, because that ultimately is what helps you incorporate the grief. One person has told me that bereavement lays diamonds that we later mine. You're not getting over it, you're incorporating it into yourself. So now we're going to talk about our third objective, because we've told you what to look for in yourself and others. We've given you some sense of how to proceed, but what does it really look like? What are some of the on-the-ground details? How do you search for? How do you allow yourself to take advantage of help when it's offered and accept that support?
There were support groups that I didn't take full advantage of. I didn't take much advantage at all, actually. I lost a parent to Alzheimer's in 1997, And of course, a lot of things have improved, and the Alzheimer's Association has grown since then. It offers so much that I wasn't aware of, but when I finally took advantage of the support groups, they were really good.
A lot of people are poo-poo support groups, but if that's where you are in your dealing with your grief, then they can be useful for some people. Here's what others have told us.
I didn't realize that I had already started to walk the path of getting well. And the group were there, and there were people who had lost a spouse or a friend. One was an uncle. I mean, they weren't all. One was a child. It didn't really matter. And everybody was in a different place. And so when I saw people that had been grieving as long as I was, I said, oh, I'm doing a little better than some of these people. I've moved along a little bit. That made me feel pretty good. There are also people that have moved way past me. And I actually got quite a few tools, both from the person that presided over the program. I got tools to use to help me get along. For example, one thing the instructor said was, your husband is like jewels in your pocket. You can put your hand in your pocket and you pull those jewels out anytime you want and look at them. And I used to do that. I'd put my hand in my pocket and say to myself, these jewels, these imaginary jewels are my husband. He's still here. I can still feel him here. And that was helpful for me. But just lots of good little tips, and we developed a certain rapport with each other.
It does help to have a close friend that you can talk to, but I don't have such a friend at Carlisle, so that's just the way it is. Talk does help, and there was someone here who did counseling, and he was helpful to me at one time.
You can't just have this is the program that's the best for everyone, because you've got people living in communities like this that are coming from various backgrounds. And support groups are going to work for some, and they're not going to work for others. Individual sessions are going to work for some, and they're not going to work for others. For the family members, I would say the same thing.
If you haven't noticed it already, the 3 speakers in that particular slide, 2 of them are residents. One is a woman who works in the environment, but has also lost her husband. And so it gives us all that perspective. It is a process to search for what works for you. If something doesn't work, to move on to something else. But we also have best practices that summarize all of this. And they are basically, it's the search that helps with grief, and the taking advantage of what you find if it's available. And when somebody offers, whether to bring you some coffee or to stroll with you, say yes. The hardest thing is just saying yes, and thank you very much for your offer. That is how you move from day to day. This slide was kind of put together to give you a feel for the variety of resources that can be available. I think the simplest one is for me, the hugging and being outside in nature helps a lot. Some people don't like to be touched, but others of us, like me, love giving and receiving hugs. So hand holding is also an important. Those don't involve language. The one-on-one, if you see the library in the other top up there, it's just 2 people talking in an area. One could be a therapist. You really don't know who's getting the support there. It's 2 people just as a friend of mine says, conversating. Sometimes you can't do live, especially during COVID. We were all sort of relegated to Zoom world. And there's a lady down at the bottom who's basically taking it in and talking to someone or listening to something that's available out on the internet. There's telehealth now in many places has become available. Medicare will pay for it. They finally realized that it does help a lot of people. Of course, the one on the far right is your traditional group setting. A lot of hospice groups will offer a series of group meetings to help people who are at the same point in the time since the loss occurred to talk amongst themselves with specific tasks. They in one group that I've talked to, they spent some time writing letters to the person who died, basically telling them the things they wanted to tell them. Anything that makes you feel better, gives you the strength to continue tomorrow is always a good thing to do. You know, some people like yoga, other people hate it. Whatever works, gardening. And the bottom line, you see the meerkats from Meerkat Manor, one of my favorite shows, and I love the fact that they're all sort of attending. Ooh, look, if you were a social person before you were bereaved, then one of your goals might be wanting to get back into Meerkat Manor and being one of the cats that are focused on things. Whatever it takes to get you to the point where you can live the life that you need to live, you get the mush out of your brain, you can reconnect, is going to be good for caring for yourself. And at this point, you can stop the video and talk amongst yourselves about what we just talked about here, because this, getting people to share what works for them. In my own case, there were songs. There's a song by Coldplay that really helped me during a period. I would play it over and over and over again until I'd gotten all the rough parts of the grief out. I still play it occasionally, but it really helped me when I was mourning the loss of my brother. So whatever works for you, whatever works. Ultimately, the best practices start with for those of you who work in these places, being aware of the resources before they are needed will really help. Then you'll have a sense of who's good to go to. A lot of people will consult their religious leaders, and that's fine if that works for you. There's a number of people out there who have practiced different faith communities, and there's some who don't want to be bothered with those folks. I'm just saying, it takes all kinds in this world. So be aware of these resources and who might get the most benefit from which resource. And like I said, it's the search. If I could put someone up there going like this, that would be it. Searching. It is the search that ultimately will take you where you need to go. We're kind of at the end here, but here's some questions to talk about in your group, because I really encourage those of you who work, and the residents too, to talk about what is happening in your workplace, in your building, when someone dies. How are you feeling at the time it happened? Was it a surprise? How'd you feel about the handling of it? Were you involved? Did you hear about it in a timely fashion, or was it late? You know, and how do you manage if your emotions are out of control? How do you manage those feelings? And between now and the next session, make some notes and bring them to share with your colleagues, with the residents. This is one of those things where we as village members need to talk to one another about. Make your notes and bring it. And no judgment. Those of you who are wanting to judge, no judging. Just let people talk. That ends my part of the session. Take some time, absorb what you've heard in this. Think about how it might apply to your particular environment, and then come back, because in the next session, we're going to talk a little bit more detail on how you can care for other people. You are the Calvary. Caring starts inside your house.